All right, hi Fennville Middle School. This is Mr. James again. I'm here with Dr. Rayman. He is a podiatrist, and so I have a list of questions that you guys have given me before I let him go. One question that I saw that I want to remind you all about is that it's not necessarily polite to ask someone about how much money they make, so I'm not going to ask him that question, but you can do a quick Google search if you really want to, and you can do that on your own time. All right, anyway, so Dr. Raymond, if you wouldn't mind, can you tell us a little bit about your job, what you do, and like what is a podiatrist?
Yep, so I'm a podiatrist. That means I'm a specialist in the foot and ankle. So I treat really any types of medical conditions that might affect those areas. Um, some of the primary areas that I deal in are sports medicine. I do a lot with diabetic foot infections and foot wounds as well. So I do amputations, and I also do a lot of skin-related deal with a lot of skin-related issues like ingrown toenails and occasionally skin cancers, warts, things like that.
All right, thank you. So how long have you been a doctor?
I've been a doctor, let's see, for about 6 years now. It'll be 6 years in July.
When did you start your current job?
I started my current job in July of 2017. I work in a private practice. Name of the practice is Foremost Podiatry. And there's 2 other doctors there. We have offices in mid-Michigan, and I also spend some time at one of the local hospitals working in their wound care clinic. I work there half a day per week, and I also do surgeries at several of the local hospitals and surgery centers.
On average, how many patients do you see on a daily basis?
I see a lot of patients on a daily basis. I usually see 35 to 40. Right now with the COVID pandemic, that's dropped off substantially. So I usually see anywhere from 10 to 15 a day right now because we're only seeing emergencies and urgent visits. So I usually see 35 to 40 patients 4 days a week. And then I have 1 day set aside just for surgeries.
So like during the current like COVID situation, are you doing those visits virtually, or are you actually going to the office to actually do it?
Most of the visits I'm doing are still in person because I do procedures, and most of them are dealing with infections. I also see seeing a lot of fractures right now as well. So, I see those patients in the office still. I also have some patients I've done surgery on in the last several weeks and months, and they have to come in to get sutures removed, things like that. So I'm still seeing those, and I do virtual visits now as well, which I hadn't done those before the COVID pandemic. So there's a little bit of troubleshooting and trying to figure out how to get things done
Yeah.
with that, because there's a lot of things that we do where the physical exam component, so me actually seeing the patient, is important. And like in wound care, my descriptions of the wound might not be in the I might not be able to do that with the virtual visit, and it's really important to the insurance companies.
Yeah. So this is kind of a big question. Could you describe your journey to becoming a doctor? Like how long did it take? How many years of school, etc.?
So yeah, it's quite a long adventure. I was a junior in college when I decided I wanted to become a doctor, and I was studying biology at Western Michigan. From there, once I decided I wanted to become a doctor, I started doing some shadowing, volunteering in, like a nursing home, healthcare settings. And from there, I graduated. I spent another 3 years doing research after I graduated from college. And then I went through the whole process of applying to medical schools, which is pretty involved. You have to take a standardized test called the MCAT, and then you have to also typically write essays. The applications are very long, typically once the medical school receives your application, you have to go for an in-person interview. Sometimes they'll do an interview like this on a Zoom or Skype, and then from there, usually you'll get a decision as far as where you made it into schools. And most people will stay local to where they live. So the nearest school for me was in Chicago. So I went to Chicago for schooling for 4 years, and from there, once you finish school in medicine, you're not done, unfortunately. You have to do what's called a residency, which is a 3-year training program where you're actually credentialed to be a doctor, but you still have to train underneath doctors who have already gone through residency training or board certified. And they teach you, how to treat patients. They teach about various conditions. In my case, I learned a lot about surgery from them as well. So, it's pretty long. The minimum amount of schooling it would take is basically 11 years or 11 years of training. So.
Oh, I'm all right. I'll keep being a teacher. I'm sure you've gotten this question before. So why did you want to be a doctor? Why did you want to be that?
Well, in my case, I had some medical issues when I was younger that kind of started the wheels turning. And once I got into college and started kind of thinking about what I wanted to do, that was one of the things that really stood out to me. And I was really interested in finding a career where I could have a substantial impact on people's lives. I treat people that have all kinds of ailments that, might be impairing their work or their ability to, just function at home. Sometimes, unfortunately, they might even be losing a part of their foot, and that can have a substantial impact on their life. But, I can usually find a way to provide them, with the means to recover from that and get on with their daily activities, get on with their, get back to work, get back to running or exercise, whatever it might be. I can usually provide that, it's really, satisfying. And, also we get to do many different things. We learn a lot of things, and we're constantly solving problems. So for anybody who's, I just naturally like, the problem solving aspects of it too. And I always, I've always liked solving puzzles and trying to come up with solutions. So.
Thank you. So this is kind of a question geared towards middle schoolers. One of my middle schoolers asked, if I want to become a doctor, how can I start doing that now as a middle schooler? Is there something that I could start learning?
In terms of learning, there's really nothing I would recommend studying at that stage in life, other than just your normal classes. The road to becoming a doctor is very long, and the people that are purely motivated maybe by financial means or their parents have pushed them into it, they get weeded out very quickly. They don't make it to, they don't make it through medical school, and they definitely don't make it through residency training. So just showing that you're a motivated individual, doing well in school at this point, and then when you get old enough to be able to participate in any volunteer activities within the medical field, I would actually recommend you explore all kinds of, if you're interested in medicine, explore all kinds of different fields. I never thought I would be a podiatrist. Even when I started thinking about going into medicine, I was shadowing different specialties, family medicine, general surgery, things like that. And I actually those other specialties really I didn't feel like they suited me well. So when I met a podiatrist through a friend, he was the one that really turned me on to it. It wasn't something that I'd ever considered being. And, I knew I was interested in medicine, but I didn't think about podiatry. So I think just getting into the healthcare setting, and, once you're in high school, you can usually start finding ways to volunteer, whether it's at blood drives or maybe at the local nursing home, things like that, going forward, and just doing well in school.
All right, thank you. All right, so now I have my more interesting, unique questions, I guess you could say.
Good. We
So,
were talking about this a little earlier. I'm used to some interesting questions.
all right, so the first of three questions that I have is, can you be born, like, can you be born with a backwards foot?
Not necessarily a backwards foot, but there are some pretty severe foot deformities that you can be born with. Clubfoot is one, where the feet are basically completely turned in. There's another condition, which is essentially where the ankle bone is completely straight up and down instead of front to back. It's called a vertical talus, and those people, their foot can be so deformed that the top of the foot almost touches the front of the leg. And then there's also people that are born with either partial or a missing foot. I do occasionally see those as well.
Wow. All right, the questions only get weirder from there. So, the next one I have is, for patients who have their toenails removed, is it is it hurtful for them? Like, is it painful?
The procedure of removing a toenail is actually done under a local anesthesia. So we do an injection beforehand. It numbs the toe, and you can really do anything at that point. You can remove the whole toenail with no pain. Following that procedure, for about 24 hours, it can be a little bit sore once the numbing stuff wears off. But no, it's generally after 24 hours, it's not painful. It's just a minor surgery. We do it in the office. Actually, one of the age groups I see that a lot in is middle schoolers. I'd say about a quarter of the patients that I remove toenails on are between the ages of about 12 and 15.
Well, I have a feeling that's someone who's probably going to lose a toe or a toenail here soon. That's probably why I asked.
It's not that bad. I do usually recommend that people don't watch the actual removal procedure, but pain-wise, it's actually not that bad.
All right, that's good to know. All right, and last but not least, what is the grossest or weirdest injury that you have seen?
I get this question a lot. The worst thing I have ever seen is a woman who was walking in a Walmart parking lot, and a truck backed over her foot. And when they realized that they had backed onto someone's foot, they decided that they needed to get out of there quickly, and so they hit the gas and basically did a burnout on her foot and tore off the half of her foot, essentially. That was pretty disturbing. That one even made me queasy, but that's not routine. That's something that's kind of like a once in a lifetime event. And outside of that, on a daily basis, I don't usually see things like that. I'd say once or twice a year, I get some kind of strange injuries. Lawnmowers are common this time of year. I'll see injuries, but those usually are not as bad because people generally wear shoes in Michigan when they mow their lawns. So, and then occasionally car accidents and things like that can cause some pretty severe injuries. But yeah, that was definitely one that stands out in my head as a substantial injury.
All right, well, those are all the questions that I have for you. Is there anything that you would like them to know about you and your job, or anything at all?
Yeah, I really love my job. My favorite thing is just treating patients. They usually come in with a major problem, and they usually leave. A lot of them will leave that day feeling substantially better. Some of them it takes a little bit longer, maybe if they need surgery or things like that. But it's a really medicine is a really rewarding career, but it takes a long time to get there. And like I mentioned earlier, if you're just in it for money or attention, it's not going to work out for you. It just requires too much effort on your part. You can't fake studying for 4 years and doing a 3-year residency. It's just not possible.
All right, well, that's all I have for you. Thank you again, Dr. Aaron, for doing this. We really appreciate it.
Yeah, no problem. It was great talking with you. If you have any, if the students have any questions directly to, I can give you my email address and they can email me any more specific questions.
Oh, that'd be great. Thank you very much.
All right, you're welcome.